All right, here's maybe the favorite chapter of the semester because it's the last one and quite interesting. I find that young people are often a little bit more morbidly fascinated by this one than some of the other chapters. We're going to talk about microbial diseases of the urinary and reproductive systems, and that includes some of the more common STDs. There's a few more that are listed in your textbook, and we're not going to cover them all because there's a few that's not common in the United States. First, we should do a quick review of the anatomy so we have a better understanding. Urinary tract infections are far more frequent in females than in males because of the anatomical differences. The urethra tends to be much longer in males than in females because of the length that the urethra has to traverse to get from the bladder through the penis. Females don't have nearly as long a distance from the bladder to exit, so organisms can travel from the outside, which is colonized, and passed up through the urethra into the bladder much more readily. The urethra sometimes has organisms in it, but as you move up through the urinary tract, it should be sterile. So regions above the prostate are sterile in men, and the bladder should be sterile in females and males. The terminology for these infections is listed up on the top. Urethritis, you should recognize as inflamed urethra. You move farther up, cystitis is referring to a bladder infection, and pyelonephritis is moving further up into the kidneys. There are 7 million UTIs a year, and for some women, this is a repetitive type of infection. Signs and symptoms involve painful urination. Often you feel more like you need to pee much more frequently than you otherwise would, and not always, but sometimes the urine is cloudy and may even smell more foul than typical. If you think about it, it might make sense. Enteric bacteria are often the cause of UTIs just because of the proximity of the anal opening and all of the organisms present in the fecal material. These organisms are physically close to the urethra. Specifically, in females, as mentioned previously, this is a bigger problem because the distance is obviously shorter and there's a higher propensity for self-inoculation. But that also leads you to the wisdom or knowledge that when you're changing the diaper of a child, especially a female, you should push back during wiping and cleaning and not bring the organisms from the fecal material forward because you can obviously introduce those organisms into the urethra, which can lead to an infection. E. coli is a very common cause, but so are other enterics. You can see the colored micrograph of E. coli. You can see its numerous fimbriae used to attach to epithelial cells. A quick factoid that is not mentioned in your book, but if you look it up, you can verify the information, is that in elderly individuals especially, UTIs can lead to confusion, which may look like dementia. So if an elderly individual that's in your proximity or in your care seems to suddenly start being very confused for no apparent reason, it might not be dementia. It may actually be a UTI. Look that up. It's a known fact and it may help resolve some issues. I'm not sure why this book doesn't mention it. Next is staphylococcal toxic shock syndrome. And you might be wondering, why is this in the reproductive infection area? Well, while staph toxic shock syndrome can occur with any staph infection where the staph is producing this toxin, it's often associated with menstruating women and the use of super absorbent tampons. These super absorbent tampons, especially ones that were on the market before the 1980s when they made the link to the condition, were a problem. But I'll get back to that in a minute. If this is not treated, it can be fatal about half of the time due to shock and the low blood pressure that results. What happens is that the toxin produced by the staph is what's called a super antigen. And what it's doing is non-specifically activating lots of T cells. This means there's a lot of T cells that have started releasing cytokines and are activated. So it's not really being presented as an epitope in MHC. Rather, this toxin is binding to the T cell receptor and activating it non-specifically. You end up with these cytokine storms, which seem to be happening with COVID-19, by the way, which you're just massively activating your immune system, and it's too much. The overactivation leads to shock, and many die from this condition. To treat, you can give antitoxin. If you remember, that's antibodies to the toxin. But you also have to remove the infection, whether it be a wound infected with this toxin-producing staph that needs to be debrided, or if it's a tampon that has been left in too long. This is what the graph looks like. You can see that in the 80s, there was this huge spike of staphylococcal toxic shock syndrome, and epidemiologists linked it to the use of superabsorbent tampons. What was happening is that women were using these and they were leaving them in for an extended period, which allowed the staph that might be colonizing the vaginal epithelial to multiply to large numbers and release toxin, which would then be absorbed into the bloodstream and cause toxic shock syndrome. Once the link was made, the FDA required that the tampons be altered, and today there's always warnings on the tampon boxes warning women not to leave the tampons in too long. They must be changed so that the population of organisms cannot get too high. The risk of toxic shock syndrome is not zero, it's still there, but you can see it's much lower. So women out there, don't leave those tampons in too long. You could be tempting fate. Importantly, remember that it's possible to have toxic shock syndrome associated with other types of staph infection. If it's the correct strain that's producing the toxic shock syndrome toxin, abbreviated TSST, it just was more commonly associated with tampon use and thus is presented in this chapter. Next, we'll compare two non-venereal diseases, so not STDs, of the female reproductive tract. The first is bacterial vaginosis. That is usually caused by one of two species of bacteria, either Mycoplasma or Gardnerella. These infections are associated with what's called clue cells. Can you see this cell that's up here on the top? Here you're looking at a swab from a vaginal sample. One cell is completely covered in bacteria. The other one below is not. This bacteria-covered cell is a clue that you're dealing with vaginosis. This bacterial infection is typically associated with a fishy odor. It's not a pleasant odor. What's linked to this? It's associated with women who have multiple sexual partners or who perform vaginal douching, which is washing out the vagina with various solutions. Typically, these solutions alter the normal pH and alter the normal flora of the vagina. That's going to lead to colonization and overgrowth of these other organisms which do not belong there in high numbers. When these other bacteria multiply to high numbers, the condition results. The other non-STD that's common is something we've briefly discussed before. Vaginal candidiasis is yeast infection that we've discussed back in the antimicrobial chapter. The organism that causes it is Candida albicans, and it's this micrograph over here. It has a very specific appearance on a stain of a slide because while it's a yeast, and you can see a single cell that's right here, it will extend and make these elongated cells called pseudohyphae. It's usually diagnosed on the signs and symptoms, but it can be confirmed with the microscopic examination where these forms are seen. It's very characteristic. If they do a quick swab and then they perform a stain to view under the microscope, if these are seen, they know they're dealing with Candida albicans. The discharge is curd-like, kind of cheesy, and it's due again to the alteration of normal pH because the normal flora is not present in the normal amounts, and that leads to yeast overgrowth. It can be very uncomfortable and itchy. Often, a vaginal antifungal is prescribed, and returning the normal flora is important. So, if women are taking an antimicrobial for some other infection, often the scenario is a woman acquires a UTI and then gets prescribed an antimicrobial. They take that, it disrupts the normal flora of the vagina, and then a yeast infection develops. And then you have to treat with an antifungal. But it's important to try to reestablish a healthy normal flora to prevent this from happening. So women are encouraged to eat things like yogurts that might potentially help restore some of the balance of the normal flora. We can stop here on this video and pick up the next video with a few sexually transmitted organisms. So see you in video 2.